Yeah, my name is Katarzyna. I'll be talking about the roles and responsibilities of a registered nurse. So we know many women who have done great things throughout history, inspired many generations, and influenced people's lives. Undoubtedly, one of them was Florence Nightingale, a pioneer of modern nursing and social care. She not only developed and improved the efficiency and standards in hospital, but also established the first professional training school for nurses, the Nightingale Training School at St Thomas Hospital in London. Thanks to her work, the reputation of nursing as an important and honourable profession has risen and also had a huge impact on the recent perception of a nurse. So what is a registered nurse? And the nursing profession is constantly evolving. According to Brennan, a registered nurse is a licensed medical professional who provides hand-on care in different medical and community settings. Obviously, with time, the role and responsibilities of a nurse have notably changed. The development of medical knowledge has resulted in an increase in the demand for qualified medical staff, including nurses. In response to the changing social requirements and progress in medicine, nurses took on more and more tasks. The range of duties of nurses is very wide. Nurses not only provide direct care but also promote well-being as a part of multidisciplinary teams. They also play a key role in the overall treatment of the patient as well as in identifying their needs and together with other medical staff implementing the patient medical plan. Recent changes and the impact on the role of registered nurses. Before the introduction of Project 2000, nurses were trained within the hospital where School of Nursing was based. Since 2013, all newly qualified nurses are required to hold a degree level qualification to increase their knowledge and improve their decision making skills. At the moment, there are 4 possible fields to qualify in: adults, where nurses look after the patient over the age of 18; child, where nurses look after children and teenagers; mental health, where nurses support patients with mental problems; and learning disabilities, where nurses support patients with learning disabilities to help them to live independently. The profession of a nurse is often associated with the care throughout person's life. This is a considerable responsibility that people working in nursing take on their shoulders. Therefore, professional development plays an extremely important role. For a nurse to be able to provide health services following the current state of medical knowledge, it is necessary to constantly update her professional skills. The number of nurses in the NHS in England has increased by 14,199 compared with last year, according to Gov. Despite the fact that more nurses than ever, a significant number of them are approaching retirement, seeking a better work balance, and even retraining. Due to changes in our population and the lack of appropriate number of nurses in recent years has been noticed. Salaries are very often low compared with the responsibilities and commitment expected from nurses. Although there are more men in nursing today than in any time in history, the profession of a nurse is strongly feminized in the UK. The percentage of working men in the nursing industry is really small. According to Ford, only 1 in 10 nurses are male, although there has been a rise in men entering the nursing profession in the last few decades. It has been a slow one. Recent changes that have an impact on nurses and their practice. So over the years, there have been many changes in the nursing profession due to political and social influence as well as progress in technology. One of the biggest technology changes that have arisen in the field of nursing is electronic charting. Instead of filling out charts with pen and paper, most nurses are now required to review the information and fill out charts online. This is a very quick and effective way of getting various information about the patient, and at the same time it makes big difference in how nurses do their job. The advancement in technology also contributed to the creation of new specialized fields of medicine and new job opportunities for nurses such as advanced nurse practitioners or nurse consultant. As respect for the nursing profession has increased, so have responsibilities and expectation. Professionalism has given nurses more control over the practice. To be a nurse, an individual not only has to practice in line with the code, but also understand the responsibilities. Also, the NHS budget and economics changes. Unfortunately, due to rising healthcare costs, many hospitals and other healthcare facilities face budget cuts, which can significantly impact patient care. Nurses already have to prioritize treatment, are greatly restricted by the tight budget. The Nursing and Midwifery Council. The NMC is one of the largest healthcare regulator for nurses and midwives in the UK. Established in 2002, the NMC sets out standards of education, training, practice and conduct for nurses and midwives. It's not only responsible for keeping a record of registered nurses and midwives, but also ensuring that all of them meet high standards and monitor their work. It also deals with serious complaints made against nurses and midwives. Importance of the NMC. So the Nursing Midwife Council disclosed that the numbers in both professions across the UK has risen to its high level. At the minute, it's 758,303. So the main role of the NMC is to keep patients safe by ensuring the registered health professional are qualified and have the right skills to meet the standards set out in the NMC code. The new standards were designed by the NMC to raise knowledge, making sure that all nurses and midwives safely perform their duties and equip it with the right skills. In order to remain fit to practice, all nurses and midwives have to revalidate with NMC every 3 years. Revalidation is about promoting good practice as well as strengthening public confidence in the nursing and midwifery profession. The NMC has a specific guide for revalidation, including 450 practice hours, 35 hours on continuing professional development, as well as health and character declaration. A professional duty of conduct. Healthcare professionals have a duty to be open and honest with the people who use the services and who choose and those close to them. This includes explaining when and why things have gone wrong and apologizing to them. At the moment, nurses have to comply with professional and statutory duties of conduct. It explains their responsibilities and also includes detailed guidance for medical professionals in the case when something is not done properly and has the potential to cause harm and distress. The implication of the NMC code. So modern medicine means constant development and revolutionary changes, not only in technology but also in people's view and behaviors. Nurses, aware of their role in our society, have been constantly trying to protect the individuality of each human being. At the same time, they have to respect patient dignity, intimacy and privacy. In order to be registered to practice in the UK, all nurses and midwives have to follow the rules of the NMC code. The code is a set of values and professional standards outlining what employees and patients expect from them. It's a structure around 4 teams, prioritize people, practicing effectively, persevere in safety, and promote professionalism and trust. It also includes the obligation to provide professional care, help to ease with suffering, the obligation to put new scientific achievement into practice. All nurses and other medical professionals are expected to deliver safe and passionate care to a high standards for the patient. However, if for some reason the care does not meet the requirement of the code, the action needs to be taken. The nurses are accountable for the decision and choices they make. They should strive not only to avoid mistakes but also to improve the healthcare quality they deliver. It's also important to work together with other staff to ensure that all tasks can be performed safely and effectively. The code also includes a set of ethical rules and helps in good decision making. Working in medical care means all nurses have a responsibility to care for individuals, promote their well-being and prevent anything that might result in harm. This is called a duty of care and something all nurses must always abide by. This is why it is crucial to understand the importance of the duty and have the knowledge and competencies to apply it accordingly. Duty of care is not optional, it's a legal requirement and you cannot choose whether to accept it. Failure to comply with the code while performing professional tasks and activities can have severe consequences for a nurse. Different types of sanctions can be imposed, including caution orders, conditions of practice orders, suspension orders, striking of order. Working in partnership with patients, their families and clinical governance. By implementing various strategies and inspection, the quality of medical has significantly improved over years. It was possible to achieve it thanks to collaboration with patients, medical professionals. The introduction of clinical governance, NIS, and also clinical audits are definitely the most important tools used to speed up improvements within the healthcare sector. Clinical audit is a way to find out if healthcare is being provided in line with standards and lets care providers and patients know whether service is doing well or where could be improvements. Reviewing the performance of medical staff is essential to understand if the work meets the agreed requirements. and standards. The National Institution for Health and Care Excellence was established in 1999 to promote the highest quality of medical care, as well as provide the best value for money. It also includes problems and disadvantage of services provided by medical teams to produce and develop recommendation and guidance. Informed consent is a person's voluntary agreement to healthcare which is made with knowledge and understanding of the potential benefits and risks involved. All nurses have to give the patient enough time not only to ask questions but also to make sure they receive enough information to make the right decision regarding their health and treatment.